biggest challenge that's really not acknowledged currently in the medical system for older adults is physical function. So things like, can you get your foot into the bathtub? Can you stand long enough to prepare a meal? Can you go upstairs and sleep in your own bed instead of on a couch? These things matter to older adults and are unaddressed currently in doctors and nurses' visits. Nobody asks, can you do these things? But they are drivers of healthcare costs and nursing home placement, which everyone wants to avoid. So over time, that's going to become compounded by the number of older adults that there are. Right now, there's an annual wellness visit for people on Medicare that is much more preventive. It screens for things like being able to bathe or dress, and those are only taken up by about 20% of people and providers, and they're not done at home. But home is where we need to understand those things, right? Home is where those things occur. I would suggest that about every 2 years or 3 years, that visit actually happen at home, and you watch and you see, does someone have difficulty getting dressed? Does someone have difficulty walking across a small room or standing long enough to cook? That would be a simple change. Along with colleagues, we developed a program called the Capable Program. It's 4 months with a nurse, an occupational therapist, and a handyman. And together they address the needs, functional and medical, of older adults so that they can achieve their own goals in their homes. And we have found that it saves healthcare costs more than $10,000 a year for at least 2 years. It cuts their disability in half and cuts their depressive symptoms as much as an antidepressant. A program like Capable that takes into account people's function and their housing could become a Medicare benefit, or it could be easily scaled through Medicare Advantage plans, or every state has a Medicaid home and community-based services waiver that it could be scaled in. There are many apps that would be able to take clinicians' knowledge plus real-time user data in terms of how older adults are moving around their homes and put those together and come up with ideas for how someone could do something more easily. My name is Sarah Szanton. I'm a professor at the Johns Hopkins University School of Nursing.